Welcome to 3M Oral Care's second live webinar in the series Infection Prevention. I'm Carissa Kerr, representing our Scientific Affairs and Education group and your host for the webinar. We're really excited to get into more in-depth with respiratory protection in oral care settings, part 2. Just to note, this is a non-CE course. Thank you for joining us today and for your commitment to your profession and education during this pandemic. Your team is dedicated to patient care, and we as 3M stand with you. The speaker for today's webinar is our very own Dr. Lois Durst. Dr. Durst receives her degree from the University of Minnesota School of Dentistry. Prior to joining 3M Oral Care as a staff dentist, Lois worked for over 30 years as a general dentist, owning a family practice in Stillwater, Minnesota with a cosmetic emphasis. Lois has been a member of the American Dental Association and the Academy of General Dentistry for her whole career and has held various leadership roles on local, state, and national levels. She earned her AGD Mastership Award and was granted fellowship in the American College of Dentists. Not only do we have Dr. Durst on the webinar, we also have our panelists, Mr. Eric Johnson, Certified Industrial Hygienist and Certified Safety Professional. Eric has his master's in public health and has worked for 3M Personal Safety for over 25 years, most recently as an application engineer. Our last panelist is Dr. Carrera. She was our presenter from webinar 1. She studied at the University of Talca, Chile, receiving her Doctor of Dental Science degree. She also earned her specialty in prosthodontics and doctoral degree. Also practiced in a dental clinic as well. I will highlight a few key points for this webinar. However, please review these details thoroughly, which is shown on your screen right now. This presentation is based on current United States federal requirements. Always consult your user instructions and follow local laws and regulations. This contains an overview of general information and should not be relied upon to make specific decisions. This is often accompanied by additional and/or clarifying information or further discussion. Complete this program does not certify in safety health. Information is current as of today and requirements can change in the future. 3M owns all rights to the presentation, and digital recording or other reproduction is strictly prohibited.
Well, good morning. Let's first go through the agenda for today's webinar. So the first thing we're going to cover is an overview of the first webinar on respiratory protection. We will then talk about some fraudulent activity related to respirators. We will discuss the imported respirators that we're seeing now. We will talk about decontamination of respirators. We'll cover fit testing and user seal checks very briefly. And we're going to talk about skin. This is something that's different to dentistry, but something that we should be understanding more about since we're wearing more respirators. And lastly, we'll have hopefully some time for Q&A. All right, first let's do a quick review of some of the things we did discuss in that first webinar of the respiratory protection series. Never before the COVID-19 pandemic has dentistry been so focused on the need for respiratory protection while performing patient care. Our profession is at an increased risk due to the number of procedures we perform that create aerosols. In fact, some surveys suggest that we have the highest risk of any profession. Those procedures that create aerosols include procedures that utilize our high and low speed handpieces, our air-water syringes, if we use lasers or our ultrasonic scalers, as well as many other activities that we perform in our offices each and every day. Of all of these, the use of high-speed handpieces and ultrasonic scalers produce the most airborne contamination. There are many different respiratory protection options that are available to help protect us as we work. The variety of options differ based on several factors, including materials, testing, and performance characteristics. First, we're going to review at a high level some of the different respiratory protection options that may be available to you. If you take a look at the image on the far left, the standard or procedural masks are meant to be single-use, disposable, simple masks that are used to cover a person's nose and mouth. Next, we see surgical masks, which have the same characteristics of the standard procedural mask, but also have an element of fluid resistance. These are what we would typically use in dentistry. The next picture shows some filtering face piece respirators. Now we'll be calling those FFS going forward, but just know that those are respirators such as our N95. And they are meant to be single-use, disposable, tighter-fitting masks that provide an increased level of respiratory protection beyond that of the simpler procedural and surgical masks. Moving to the next box, we see the elastomeric respirator, which is a reusable respirator available in half and full facepiece configurations as shown in the picture, and which do require a bit of assembly. The filter component needs to be attached to the mask for it to provide its intended level of respiratory protection. Then lastly, the image to the far right shows the powered air purifying respirators, or PAPRs. These two are reusable devices that come in a variety of head and face cover offerings. These also require a bit of assembly before use, including the head or face cover, tube, the battery pack, and the belt. Fitment of these respiratory protective devices varies. Procedural, surgical mask, and PAPRs are loose fitting on the face, whereas FFRs and elastomeric respirators have a more snug fit and seal to the face. The products that are designed to filter against airborne particles with at least 95% efficiency include the respirators, which are the FFRs, elastomeric, and the PAPRs, thus helping to protect the wearer from airborne particles present in the environment, such as SARS-CoV-2. Some of the respiratory protection options have the ability for parts of the assembly to be cleaned, which is the case for the reusable elastomeric respirators and the PAPRs. In the United States, selection and use of respirators is governed by the Occupational Safety and Health Administration, or OSHA. OSHA has a respiratory protection standard that specifies the requirements for employers assigning respiratory protection to workers. Those requirements include medical evaluations and fit testing of respirators, among other requirements. Respirators in the United States are then tested and certified by the U.S. National Institute of Occupational Safety and Health. Testing and certification is based on the respirator's physical and performance characteristics, including filtration efficiency. For example, the N95 rated respirators have a filtration efficiency of at least 95% against non-oily particles. Surgical masks and surgical respirators, on the other hand, are cleared for use as medical devices by the U.S. Food and Drug Administration, the FDA, or equivalent agencies. So when it comes to surgical N95 respirators, they are both approved by NIOSH as an N95 respirator and also cleared by the FDA as a surgical mask. So let's talk about the CDC recommendations. During this public health emergency of the COVID-19 pandemic outbreak, many healthcare institutions, including dental offices, are experiencing shortages of N95 respirators. The CDC has issued a document called Strategies for Optimizing the Supply of N95 Respirators. In this document, the CDC makes recommendations based on conventional capacity strategies, contingency capacity strategies, such as what we would do during expected shortages, and crisis capacity strategies, what we would do during known shortages. Contingency and crisis strategies are utilized when the conventional strategies are not adequate and include things such as the use of N95s past their shelf life, the extended use of N95s, the use of other types of respirators, use of respirators from other countries, and the reuse of respirators. Decontamination of respirators is only used in crisis situations as a last strategy. Unfortunately, there have been a number of fraudulent, price gouging, and counterfeit activities that are occurring in connection with the COVID-19 pandemic. 3M is committed to help combat this fraudulent activity and is working with law enforcement authorities around the world, including in the United States, the U.S. Attorney General, state attorney generals, and local authorities. Examples of this fraudulent activity include people fraudulently representing themselves as being affiliated with 3M and having authentic 3M product to sell, selling or offering to sell 3M products at grossly inflated prices, selling counterfeit products falsely claimed to be from 3M, and falsely claiming to manufacture 3M products. In many cases, these scammers will try and secure funds in advance and then disappear once the money is received. With regard to 3M respirators specifically, the following can provide you some information to help identify and avoid fraudulent activity. 3M respirators should be sold only in 3M packaging, with model-specific user instructions accompanying the product. 3M respirators should not be sold individually or without packaging, including the user instructions. 3M has strict quality standards, and therefore products that have missing straps, strange odors, maybe blocked valves or misspelled words, etc., are likely not authentic 3M respirators. Finally, 3M personal protective equipment is intended, labeled, packaged, and certified to meet the requirements of the countries in which 3M sells it, which differ around the world. 3M has also not changed the prices for respirators sold around the world and has published current single case list prices for many of the most common 3M N95 respirator models sold in the US. This can be found in a 3M technical bulletin named Fraudulent Activity, Price Gouging, and Counterfeit Products, which is linked at the bottom of the screen. 3M also has a COVID-19 fraud hotline for the United States and Canada that dental offices and purchasers of 3M products can call for information to help detect fraud and avoid counterfeit products. You can reach this hotline by calling 1-800-426-8688. In addition to the hotline, you can report a concern on our webpage. I'm now going to discuss the use of respirators from other countries, something that has become kind of confusing as dental offices are reopening and trying to secure adequate supplies of PPE. Moving on to address the issue of shortages of N95 respirators, the CDC, FDA, and OSHA have all announced temporary recommendations during the pandemic. The CDC's report on strategies for optimizing the supply of N95 respirators, which we have mentioned before, recommends that healthcare institutions, including dental offices, that no longer have access to NIOSH-approved N95 respirators, consider respirators approved under standards used in other countries that are similar to NIOSH-approved N95 respirators for occupational use. The FDA has issued several emergency use authorizations, which, remember, are temporary, but they address the emergency use of certain imported disposable FFRs that are not NIOSH approved by healthcare personnel in the United States. Likewise, OSHA issued an enforcement memorandum on April 3, 2020. Specifically, it outlines enforcement discretion to permit the use of FFRs and air purifying elastomeric respirators, which are certified under certain standards of other countries or jurisdictions. You may remember this, but in early April of this year, 3M reached an agreement with the U.S. government on a plan that, with the Trump administration's assistance, under the Defense Production Act, enabled FEMA to import 166.5 million respirators into the United States over a 3-month period starting in April from 3M plants in Asia, and this is to help bolster the supply of FFRs in the United States. FEMA is distributing these respirator models to state authorities, and the states will determine distribution to healthcare facilities based on need. FEMA is shipping these respirators directly from 3M facilities in Asia, and these models will arrive in their Asia packaging. These respirator models hold various approvals, including, in some cases, NIOSH N95. All of these different countries' approvals incorporate testing for filtration efficiency and inhalation and exhalation resistance of the respirator. The 3M model number will be printed on the packaging and the respirator. 3M has taken steps to try to ensure that English user instructions are provided to organizations receiving these respirators, including posting user instructions for these respirators on the 3M website, and you can see that link here. So questions to ask yourself when you receive imported respirators to ensure they are authentic and genuine 3M product would include, did you receive the product directly from FEMA or from FEMA via a state authority, maybe such as a board of dentistry or a state association? If yes, your respirators are authentic 3M product. Was your organization required to pay for the product? If your answer is yes to this, your respirators are not the ones manufactured by 3M and imported and distributed by FEMA and may be counterfeits. Ironically, on June 5th, just last week, or is that this week, it was announced that the ADA has received 350,000 3M-made KN95 masks from the national stockpile, and FEMA has promised to send up to 1.5 million in the future for the use in dentistry. This continues to evolve, but it's exciting news for our profession since we have been struggling to secure this PPE. So some of you may be asking, where are these imported respirators coming from? The supply of 3M FFRs manufactured in Asia that are being imported and distributed by FEMA are coming from many parts of Asia, including China, South Korea, and Singapore. So when you consider the differences between the non-NIOSH approved respirators being imported versus the NIOSH approved N95s, one thing you might notice is a shape. Several of the respirator models that FEMA is acquiring and distributing have a construction called vertical flat fold, which is not usually seen in the United States. These respirators are packaged flat with a vertical fold through the middle, but open up into a cup shape, such as the mask pictured in the upper right. As these respirators are designed for people with facial features common in China and Asia, they may not fit as well as respirators intended for sale and use in the United States. And lastly, these respirators may also be different colors than what you are used to seeing. They may be white or gray or blue. An example of a gray one is pictured on the bottom right of the screen. Now let's talk about the similarities among the non-NIOSH imported respirators. Like the cup style, the horizontal flat folds that are usually sold in the US, these imported models have two bands and a metal nose clip. The nose clip is folded in half at the top of the facepiece. The first step in putting on these respirators is to open the facepiece into a cup shape. After that, donning or putting on the respirator follows steps similar to those for cup style and horizontal flat fold style. Because these respirators may not fit the same as respirators intended for sale and use in the United States, users must be fit tested before use. And lastly, some FEMA imported respirator models are the same as models that are common in the United States, but will be in packaging with Asian languages. It is very important to understand that if a fit test cannot be conducted or the wearer cannot pass a fit test, then these products should be used as a face mask, not as a respirator. So let's review some general reminders on respirators. Individuals using respiratory protection should always carefully read and follow the user instructions for the model of the respirator they are using. It is very important that the user be clean shaven, and of course follow the donning instructions exactly to get a good seal between the respirator and your face. If you do not have a proper fit to your face, you will not get the expected protection from the respirator. And finally, training and fit testing must be done with each new respiratory model. respirator model, and a user seal check should be done each time you don the respirator. There is one type of respirator that is being imported by FEMA and distributed to healthcare organizations that I would like to specifically talk about. It's called a KN90. This is a respirator performance class in China, like N95 is a respirator performance class here in the US. Two KN90 models are on FEMA's list of products to import into the United States, the 9001 and the 9002. However, the filtration efficiency requirement for the KN90 respirator is lower than the 95%. Therefore, it is not included in the list published by the CDC and OSHA of respirators from outside the U.S. that are considered to be equivalent to the NIOSH N95 respirators. For this reason, 3M and NIOSH are recommending that KN90 respirators not be used for respiratory protection, but rather used as face masks or isolation masks. The KN90 models do not need to be fit tested when used as face masks. I'm now going to talk about the decontamination of respirators. Prior to discussing this, though, it's important to remember that the CDC and NIOSH do not recommend that FFRs or respirators be decontaminated and then reused in standard practice. Decontamination and subsequent reuse of FFRs should only be practiced as a crisis capacity strategy during this time of the COVID-19 pandemic, as mentioned previously. All right, moving along. As we reviewed earlier, the CDC discusses reuse and extended use of N95s as a crisis capacity strategy to be utilized temporarily during the pandemic. They have created a document called the Recommended Guidance for Extended Use and Limited Reuse of N95 Filtering Facepiece Respirators in Healthcare Settings, and have published new guidelines on decontamination and reuse of filtering facepiece respirators. According to the CDC, research indicates the virus, SARS-CoV-2, survives for up to 72 hours on a variety of surfaces. Therefore, CDC is recommending a wait and reuse approach before consideration of other decontamination approaches. One strategy to mitigate the contact transfer of pathogens from the FFR or the respirator to the wearer during reuse is to issue 5 respirators to each dental health worker. The worker will wear 1 respirator each day and store it in a breathable paper bag at the end of each shift. The order of FFR use should be repeated with a minimum of 5 days between each FFR use. This will result in each worker requiring a minimum of 5 FFRs, providing that they inspect, put on, take off, care for them, and store them properly each day. Healthcare workers should treat the FFRs or the respirators as though they are still contaminated, even if beyond 72 hours, and follow the precautions outlined in the CDC's reuse recommendation. Respirators should be inspected carefully for signs of damage, wear, fatigue, or soiling before each use and reuse. If supplies are even more constrained and 5 respirators are not available for each worker who needs them, then this might be a time that respirator decontamination may be necessary. According to the CDC, regarding the decontamination of respirators, an effective respirator decontamination method would reduce the pathogen burden, maintain the function of the respirator, and present no residual chemical hazard for the wearer. Decontamination might cause poorer fit, decreased filtration efficiency, and decreased breathability as a result of changes to the filtering material, the straps, the nose bridge material, or strap attachments of the FFR. Per the CDC guidelines, a number of sterilization companies are assessing decontamination processes for the N95 respirators. The FDA is evaluating granting emergency use authorizations for such decontamination systems during the COVID-19 outbreak. 3M is collaborating with several sterilization companies and institutions which are investigating ways to safely decontaminate 3M's N95 respirators in line with the CDC guidance. In 3M's work with external manufacturers of sterilization equipment, 3M relies upon the developer to confirm the germicidal efficacy of the method and to provide information on potential hazards to the respirator user. It is important to note that 3M evaluates the effect of the particular decontamination method only as it applies to the filtration efficiency and integrity of our respirators, not on the efficacy with regards to deactivation of the virus that causes COVID-19. Methods currently under evaluation include vaporized hydrogen peroxide, UV, and low temperature moist heat, amongst others, as reflected in the CDC guidance. So recall again that a respirator can only work when air passes through the filter. Air will take the path of least resistance, so if the seal isn't there due to maybe damage caused by the decontamination method, the air will go around rather than through the respirator and therefore lessen the protection. If as a result of decontaminating a respirator, the filtration is damaged or the respirator does not fit, it will not help reduce exposure to airborne particles at the level indicated. Details in this table represent completed testing done by 3M, evaluating the filtration efficiency and integrity of certain decontaminated 3M respirators where emergency use authorizations have been issued by the FDA. While vaporized hydrogen peroxide decontamination methods by several companies have passed 3M's testing for several of our respirator models, and they also have been issued emergency use authorizations, these methods have more implications for larger healthcare settings like hospitals. There are other decontamination methods that have passed 3M's filtration efficiency and fit evaluations for certain 3M respiratory models, but they do not have an FDA emergency use authorization at this time. This includes other companies using vaporized hydrogen peroxide, ultraviolet light, which I'm sure many of you have heard about, and moist heat. At this time, there are no methods for decontamination of respirators that have passed testing and have been granted an emergency use authorization for us to use in a dental setting. For the most up-to-date information, and of course, this area is changing quite often, we recommend you read the 3M Technical Bulletin, Decontamination Methods for 3M N95 Respirators, as this is updated as new information is received and/or additional testing is completed. It is important to know that there are several decontamination methods of 3M N95 respirator that 3M does not recommend, some of which you may be seeing on social media or in certain dental websites. These include the use of ethylene oxide due to significant concerns associated with the potential for repeat inhalation exposure to ethylene oxide residuals, which are a known human carcinogen. Ethylene oxide is an accepted sterilant for many device types. However, given that the respirator is directly in line with a person's breathing zone, it is not recommended for respiratory decontamination. The use of ionizing radiation is also not recommended due to degradation in filter performance. 3M also does not recommend the use of microwave due to melting of the respirator near the metal components like the nose clip, resulting in compromise of fit. And lastly, 3M does not at this time recommend the use of high temperature, autoclave, or steam due to significant filter degradation. 3M does anticipate, however, that additional information will be available as this work is completed and reviewed with regulatory agencies. Considering the many variables involved in the process, decontamination of FFRs in the United States should follow all requirements of the current emergency use authorization issued for each specific decontamination method. If by some chance you do have some decontaminated respirators in your office, the CDC recommends that healthcare providers should take the following precautions prior to using a decontaminated respirator. Users should clean hands with soap and water or an alcohol-based hand sanitizer before and after touching or adjusting the respirator. The user should avoid touching the inside of the respirator. When donning and performing a user seal check, use a pair of clean gloves. Visually inspect the FFR or the respirator to determine if its integrity has been compromised. Check that components such as the straps, the nose bridge, and the nose foam material did not degrade, which again can affect the quality of the fit and seal. If the integrity of any part of the FFR or respirator is compromised, or if a successful user seal check cannot be performed, discard the FFR and try another one. Lastly, users should perform a user seal check immediately after they don each FFR and should not use an FFR respirator on which they cannot perform a successful user seal check. All right, let's move along and let's discuss fit testing and user seal checks. Fit testing of tight-fitting respirators, like an N95, is an essential best practice and a regulatory requirement in the United States. It helps confirm that a particular respirator model can fit a person properly. A good seal with the face helps ensure that air will travel through the respirator's filter material instead of around the sides of the respirator. A fit test must be conducted whenever a new tight-fitting respirator model is assigned to an employee. Let's review the regulatory landscape, and I know this slide has a lot of information on it, but let's go through it. So during the COVID-19 pandemic, multiple U.S. federal agencies have issued temporary guidelines and regulatory permissions regarding fit testing. As mentioned earlier in their presentation, OSHA has enforcement jurisdiction over respiratory use in the United States workplaces. On April 3rd, OSHA issued an enforcement memorandum which permitted healthcare employers to delay the required annual fit test if the organization had spent a best faith effort to try to conduct fit testing and were unable to locate enough respirators or fit test supplies. Then on April 8th, OSHA released another enforcement memorandum which built off the April 3rd memorandum. This one said that if a respirator manufacturer had data to support what is called fit crosswalks from one respirator model to another, very similar model, then OSHA would dismiss the need to conduct a fit test on a new model if an employee had already passed a fit test on the crosswalk model. 3M has published a technical bulletin which identifies several pairs of 3M respirator models whose fit is predictive of each other. The CDC and NIOSH have both advisory roles in this situation. They have both published similar guidance that during COVID-19, because of the challenges related to availability of fit test supplies and respirators, employees may consider skipping the annual repeated fit test and perform qualitative fit testing instead of quantitative fit testing. NIOSH also says that in extreme cases, if employers find that fit testing is simply impossible, then even without fit testing, a respirator will provide better protection than a face mask or using no respirator at all. Even with all the guidance and temporary regulatory allowances that have been issued during COVID-19, it's important to know that the initial fit testing is still required anytime a new respirator model is assigned to an employee, even in dentistry. Examples of this situation for healthcare organizations right now may include a delivery of FEMA-imported respirators from Asia. There may be a distribution of non-surgical respirators from a stockpile, or in some cases, healthcare organizations that may choose to switch to elastomeric respirators for some of their uses. In each of these cases, fit testing would need to be done before any worker wore the new respirator for the first time. 3M has assembled several fit test resources to help support healthcare customers during COVID-19 and through all fit testing activities. All of these can be found linked on 3M's website. And I just want you to know that I have found these to be extremely helpful during this time. There's a lot of very valuable information here. Regarding what we just talked about, the first linked document is a technical bulletin which contains an explanation of OSHA's April 8th enforcement memo and the pairings and groupings of 3M respirators whose fit is similar. The remaining resources cover hygiene considerations during COVID-19, the importance of fit testing, and information regarding the training of personnel for fit testing. We will dive deeper into fit testing in our next webinar in our series. Okay, skin safety. In this next section, we are going to be talking about some factors that can contribute to skin injury while wearing tight-fitting respirators, and some strategies for prevention with 2 skincare products made by 3M. While we may in dentistry be familiar with some skin issues, like maybe a contact dermatitis associated with wearing gloves, or maybe we get some skin irritation from our glasses or loupes, we now need to understand skin safety as it relates to continued long-term use of tight-fitting respirators such as N95s. This information, just FYI, is provided by our colleagues in the Medical Solutions Division. I have included their website on this slide in case you would like more information on skin conditions than what I provide today. Let's begin by discussing some anatomical considerations when we wear respirators or masks. Over many parts of the body, there is subcutaneous tissue, or fat, which has had an important function to act as a cushion and a shock absorber for mechanical forces like pressure and shear. The lack of fat over the facial structures like our forehead, the bridge of the nose, our cheeks, and even the ears makes these areas particularly vulnerable to pressure injury. There are a number of key factors that can contribute to skin injury under personal protective equipment, most notably mechanical forces. So pressure is a mechanical force that creates injury by loading skin and soft tissue, and we understand that the primary mechanism of injury is by deformation of our soft tissue. This in turn leads to a cellular deformation and ultimately can create damage to the cell structure and eventually lead to the damage we see in skin. The extent of tissue damage, as in the event of a pressure injury, let's say, is variable, ranging from erythema, which is a superficial reddening with the epidermis intact, to potentially deep, full-thickness wounds extending to bone. The severity of a pressure injury is not only influenced by the amount of tissue loading, the amount of deformation, and the amount and duration of a pressure, but it is also related to individual tissue tolerance. As you can see, there are a number of factors at work. For more information specifically on pressure injuries, visit the National Pressure Injury Advisory Panel website at npiap.org. Another mechanical force that can cause damage is friction. So if you remember back to physics, friction happens because of the resistance of one object against another. It is dependent on the properties of those objects, and in this case involves skin and our PPE. Skin damage can happen when you have continuous or repetitive sliding or rubbing of these items. Friction injury typically manifests itself as erythema or superficial abrasions. Friction is really a superficial force that does not cause deformation of tissue. Shear strain, on the other hand, is a mechanical force that acts parallel to the skin and does cause deformation of tissue. This deformation can contribute significantly to development of a pressure injury on your face. This can be a bit confusing, but it's important to understand that friction is necessary for shear to deform tissue. If you minimize friction, you have the ability to minimize or eliminate damage from shear strain on your skin. Another factor that we want to consider is the presence of excessive moisture on the skin. So our skin likes to be dry, not excessively dry, but pretty dry. When skin is excessively hydrated, we see significant changes in skin structure and the function of the mask or respirator we are using. So in a normal situation, without any PPE on our face, any moisture on the skin evaporates. With a PPE on, you see an increase in skin surface temperature, leading to increased wetness, and the normal evaporation is limited and the wetness increases. With the increase in wetness, you see a decrease in the skin breaking strength and an increase in frictional forces. So this is a vicious cycle that increases the likelihood of skin breakdown underneath our respirators. So let's discuss some of the strategies that can be used to prevent skin damage when you wear a tight-fitting respirator like an N95. First, you want to pick a respirator that fits you comfortably. As you don the respirator, it's really important to not over-tighten it. Now, I know that we've said before that your respirator should be tight, but tighter is not actually better, and too much tightness can interfere with the seal and increase the risk of skin injury. Next, adjust the headbands so they are in the correct position. You don't want the headbands to rest on your ears, so the top one should be above your ears and the lower one should be below your ears. You do not want to ignore any discomfort or pain under any protective equipment. Obviously, this is a warning signal of potential skin damage. And as soon as you can get away from the patient care area, you want to remove the PPE and relieve that pressure and friction. Of course, following your facility infection control precautions for doing so, and making sure you're redoing the seal test when you replace the respirator. And finally, you want to protect the skin from moisture and friction. And many of us know that it can get really hot under N95 respirators if you wear them for a long period of time. So let's talk about options if you do have some skin changes from wearing tight-fitting respirators. It is important to remember that fit and seal of the respirator is the primary concern for your protection. There is a lot of information on social media and various websites recommending the use of various wound and skincare products, and a lot of it does not consider the impact on a seal. If you feel you should wear a dressing or a bandage over an area of skin injury on your face, the thinnest, most low-profile dressing available should be selected. Once a dressing has been applied, a fit test should be performed. I also want to address the use of common skincare products such as creams and ointments, which we all use, which sit on the surface of the skin. In addition to interfering with the seal, they can cause the respirator to slip and slide, which of course results in no seal and possible friction. The bottom line is, if a product is being recommended for use under a respirator, ask the manufacturer for their data showing that the seal of the FFR is maintained with that particular product. The National Pressure Injury Advisory Panel suggests the application of a liquid barrier film or skin protectant to help prevent skin damage from friction and moisture. 3M is in the unique position of being both a manufacturer and developer of skincare products and respirators. We did fit testing on 2 of our polymer-based skin protection products, the Kevlar No Sting Barrier Film and the Kevlar Advanced Skin Protectant. This testing showed that both of these products can be used under 3M N95 respirators without interfering with the seal. So I want to walk through the different considerations really quickly for these 2 products, because these are something that you probably are not aware of. So the Kevlar No Sting Barrier Film, which is on this slide, is an alcohol-free liquid barrier film intended to protect skin from bodily fluids, adhesives, and frictions. So it is very well suited to protect our skin under PPEs. You can see how it's applied in the upper right corner. They are 1 milliliter wipes or a 1 milliliter wand applicator. This product should be applied to clean, dry skin over areas of our face where our respirator is going to sit, and you can see in the picture where those areas might be. You want to definitely avoid the eye or the eyelid. This product should be allowed to dry completely. We recommend waiting at least 90 seconds. We also recommend starting with a once daily application of this product. If the buildup of the product occurs, you can decrease the frequency of the application to maybe 3 times per week. And lastly, removal is not necessary with this product unless you want to, and it can be removed with a medical grade adhesive remover if you decide to do that. The second product is called 3M Cavalon Advanced Skin Protectant. This is also a liquid-based product, but this is a product that's used to protect the skin where there already are areas of superficial skin damage or abrasion. So we use this one to protect against additional damage. So you can see that there's a slightly different type of applicator. It's 0.7 milliliters. And this one, like the other one, needs to be applied in a thin layer on a dry face. You want it to dry for 90 seconds like the other product. And because this product is more durable than the Cavalon no sting barrier film, we recommend starting with 2 to 3 times per week, not daily. If the buildup of this product occurs, then you can decrease the application to maybe 1 to 2 times per week. And also similar to the Cavalon no sting barrier film, this product does not require removal. If you want to remove it from your skin, you can use a medical adhesive remover containing a silicone. And finally, with both of these products, it's important to know that if you do develop a full thickness pressure injury, please seek help from a wound care specialist.